At HealthCare Partners Medical Group, our mission is to provide the highest quality of healthcare to each and every patient. With 5 locations in Pahrump, we are local doctors you know and trust. We want to thank you for choosing us. Quality care starts here.
Energy drinks have been around for a few decades, and especially in the last 10 years, we've seen higher and higher consumption of these. Interestingly, about 2/3 of all energy drinks are consumed by people between the ages of about 15 and 35, and 2/3 of those are guys.
Do they give you energy?
They make people feel like they have energy, but they actually don't give anybody any extra energy. Energy drinks have large amounts of caffeine. A given amount of an energy drink has anywhere from 2 to 10 times as much caffeine as the comparable volume of, say, Coca-Cola or tea or coffee. So the energy feeling comes from the caffeine stimulation.
Is there any health-related issues that can be contributed to energy drinks?
Well, there are many actually. Because the caffeine dose is so high and it's so easy to consume the large amount because the amount that it comes in is small, you get much more stimulation of the heart and high blood pressure, even triggering cardiac arrhythmias or rhythm disturbances, and this feeling of severe palpitations, a sensation like the person's going to pass out, which leads to often emergency room visits. And we have data on emergency room visits that's tracked by the CDC, and we know that emergency room visits for caffeine-related problems peaked out in 2008, but even last year was still around 12,000 emergency room visits in the whole year.
If you're taking energy drinks for a longer period of time, can that have a lasting health effect?
The effects of caffeine are always diminished as soon as you stop using it, so you don't get a long-term effect from caffeine. You develop a tolerance, so the more you drink, the more you have to drink to get the same effect, and then there's a withdrawal effect, but there's no long-term effect. The effects really with these are more short-term and sudden.
Is there any benefits to drinking these?
There's no known benefit. In fact, there's actually documented decrease in athletic and energy-related performance because these drinks promote dehydration. For every 1% decrease in your body's hydration, it leads to a documented 10% decrease in your athletic performance. So these drinks act really as diuretics and deprive the body of needed nutrients and fluids, and paradoxically actually decrease physical performance.
You wouldn't recommend taking these energy drinks when you're going to the gym, working out?
No, definitely not. In fact, because when you're going to the gym and working out, you're already increasing your heart rate, your blood pressure, you're sweating, you're losing fluids and electrolytes. Taking these is of actually no benefit and actually of some harm. On the other hand, drinking one energy drink in a day really has no consequence. What we're talking about here is consuming multiple of these beverages in a short span of time.